Welcome to the Interprofessional Space podcast, where the spirit of inquiry meets healthcare collaboration. In our podcast, we discuss all things interprofessional education. According to the World Health Organization, interprofessional education, or IPE, is when students from at least two healthcare professions learn about, from, and with each other to improve health outcomes and enable effective collaboration.
Todd Hinson serves as the Registrar and Student Services Officer at the University of New Mexico Health Sciences Center, where he plays a key role in advancing student success and academic operations. With over 15 years of experience in health sciences education, Todd brings a strategic blend of administrative leadership and scholarly expertise. He is currently pursuing a PhD in learning sciences with research focused on enhancing interprofessional education, developing more effective collaborative approaches to training healthcare professionals. His work reflects a deep commitment to innovation in teaching and learning, aligned with the mission of improving health outcomes through interdisciplinary education.
Heidi Honegger Rogers is a family nurse practitioner, advanced practice holistic nurse, and associate professor at the University of New Mexico College of Nursing. A senior fellow in planetary health, she serves on the leadership team for the university's Accelerating Resilience in Drylands Institute and formerly directed IPE at UNM's Health Sciences Center. Her work focuses on climate and health, equity, planetary health, and IPE. She serves on the board of the Academy of Integrative Health and Medicine, leads the Planetary Health Task Force for the American Holistic Nurses Association, and collaborates with several environmental and health organizations. She is also a certified nature and forest therapy guide and facilitator with The Work That Reconnects. Welcome. We're so glad today to be joined by Dr. Heidi Honegger Rogers and Todd Hinson. Welcome. We're so glad that you could join us today.
Yeah, thanks, Ann and Susie. We are just absolutely thrilled to be here talking to you about all things IPE.
I agree 100%. This is exciting.
Wonderful. So could you start by telling us a little bit about your current roles at the University of New Mexico Health Sciences?
Sure. I'll start if that's okay, Heidi. Currently I am the Registrar and Student Services Officer at the Health Sciences for the University of New Mexico. I also am an adjunct professor in the Learning Sciences on our main campus. And with that, I work with all the health science programs, work with making sure that the students are on track and that they get registered and that they graduate on time and all of those happy things that we all need them to do.
I'm going to add to Todd's introduction about Todd. Todd has been at the University of New Mexico most of his professional career. He is an educator and a deep lover of learning and the students that the University of New Mexico brings in. And he has managed to transform so many parts of the University of New Mexico in both his role as staff and also his role as adjunct faculty. And so when I first met Todd years ago, I saw somebody who deeply, deeply cared about the mission and the fact that we were able to come together to co-create the new interprofessional education program at UNM. Just the opportunity I had to work with Todd, who has a business background and an information and learning sciences background, was really special for me. I have been the director of the Office of Interprofessional Education from 2018 to 2024. That position rotates fairly frequently, and so I'm I'm still on the IPE team, but I am not the director. My current role is I'm an associate professor in the College of Nursing. I teach in the graduate program in our BSN to DNP for all of the APRN tracks, midwifery, family nurse practitioner, pediatrics, all of those. And I'm also in leadership at the University of New Mexico in the ARID Institute, which is a Category 3 institute across the University of New Mexico, accelerating resilience and innovations in drylands. So I actually have a leadership job in one of our most interdisciplinary centers at the university. So we're working with faculty and students from programs all over, not just health professions, but all of our programs.
Wonderful. Just a quick follow-up question, just to give folks who may not be familiar with the university sort of a frame of reference. How many students how big is this institution?
Yeah, so we have 26 to 30,000 students, depending on the year, but averaging around 28,000 over the last 5 years. We have 4 branch campuses and a big main campus. We're a Tier 1 Carnegie research institution, and we have, with our branches, associate's degrees all the way through PhDs and professional doctorates.
Thank you.
So can you give us a little bit of a background on what got you into interprofessional education, or what drew you to it initially?
Yeah, for me, it was interesting in my role as registrar at the time. There was a couple sort of watershed moments for me, but the IPE office was sort of small at the time, and they were really struggling to say, well, when can we do IPE events? How can we, when's the best scheduling? How can we do that? And so they came to me, and so I put together a master schedule of all the health science programs so that they could see the busy times and the not so busy times, and so that they could then schedule at least 2 or 3 professions at a time to do an event. Like it's pretty rare in an institution our size that all of our programs are going to have the time at the same time. And so, we have MD and PharmD programs, and those 2 programs have 2 6-month terms with very little breaks, and so, or very few breaks. So we needed to, and we want to include those programs. So that was my first moment of like, well, what is this, and what do you all do? And it was very similar to how I think, and I just said, hey, can I go to those meetings too? Kind of thing. And so I just started like, well, what can I do to help? And I just sort of like volunteered and sort of self-invited myself to the team. And I guess the rest is history a little bit. But that was the big moment, and then them accepting me, that was the other moment. So and seeing that the administrative part of what IPE is important, because without that we can't manage to do all the cool events and get the students together without that other side of the house. So those were kind of the 2 moments for me. Heidi had come on as the director about the same time, and so we just hit it off, and I'll let you take it from there, Heidi.
Yeah, absolutely. So yeah, Todd has an incredible ability to do Tetris, just moving schedules around, looking at which courses are taught where and when. How do we, how can we help faculty from across programs really coordinate, times that they can do things together with their students. Todd's got a very magic and special brain that can look at that kind of stuff. So yeah, and for me, I've been a family nurse practitioner working mostly in primary care, and early in my career, and always working in federally qualified community health centers, so working really deeply in interdisciplinary teams. And so early in my career, I don't know, magically managed to actually be working at the Healthcare for the Homeless clinic in Albuquerque with the person who was actually the current director of interprofessional education at the university. And she and I and a couple of other faculty and clinicians developed a curriculum for students rotating through Albuquerque Healthcare for the Homeless. And so that was way before I even started teaching or being affiliated with the university. But I actually helped to co-create one of the early curriculums for the UNM medicine, nursing, and pharmacy programs. So I think I'd always been interested. And then when I came to the University of New Mexico, I was immediately wrapped in love and brought into the IPE program because that director really had worked with me for a long time, and so I felt loved and mentored into IPE, and then yeah, she retired, and one of our colleagues, actually a person who is worthy of mention on this podcast, Dr. Amy Levi. Amy is
100.
Yeah, Amy actually supported Todd and I. She was the director of interprofessional education, and then she moved up and ended up being the boss over both Todd's programs and my programs. She's the one who introduced the two of us, and then was the one who, when over several cups of coffee, where we invented the honors program, Amy just looked at us like, yeah, let's do it. So we got so much support from her. So yeah,
we wouldn't be here without Amy. Yeah, we would not be here without Amy. She pulled this together, and she said, you guys would be a great team. I know that. And she was right.
Yeah.
She's a visionary, it sounds like.
Yeah.
That's fantastic.
She is. She still is.
And we should say, that's the role of leadership, is to see people who are energized, who are creative, to put them together and to let them run, right? And so to have a leader who was like, yeah, figure this thing out and be as broad and out of the box as you can be. That's really honestly what allowed me and Todd to have we had so much fun doing this project together and working together for years, and B, and it really allowed us to transform what IPE looks like at the university.
That's exciting. And we are going to dig into that IPE honors program. But before we do that, let's just talk a little bit about theory practice gap. So in a recent podcast that we did, Susie and I talked to a former student who had graduated, and he gave us his perspective on that challenge of, you go through all this IPE as a student, and then it doesn't always look like that when you get to practice. And so I'm just curious if either one of you or both of you would like to comment on, preparing students for that theory practice gap.
Yeah, I have strong opinions about this, so thanks. I'm gonna take it. And so, it's. I think one of the things that we always assume as faculty is that students don't understand how to work together. But actually, I think what we've found is that the students come in to health professions programs knowing exactly how to work together, knowing exactly how to collaborate. They may not necessarily understand all of their roles and their own, sort of like becoming in their own health profession. But in terms of communication, partnership, most of our students, what we've really noticed is most of our students are, they come in knowing exactly how to do those things. And then we kind of beat it out of them in our clinical placements, right? So, our healthcare systems, particularly in the United States, are not set up for true interdisciplinary collaboration. We are fee-for-service systems. We are looking at illness. We are, you're in this lane, I'm in that lane. We barely do a good job, from my opinion, in actually partnering with patients. So this theory practice gap, I think the students know how to do it, but then when they get into practice, the systems that we are putting them into are not conducive to interprofessional collaboration. What I think we have a responsibility as interprofessional educationists or ERs, I think our responsibility is really to really spark students, to let them know, like, we actually are going to need to be redesigning, rethinking these systems. These systems are not stagnant. And we know in the US, these systems aren't working all that well for our patients. And so I think, TBD, we've been having these conversations with our students for years, and we'll see how it works for them. But I think the first thing we say is, you're going to go out into systems that aren't supportive of this kind of collaboration. And it's up to you all to really transform the healthcare systems to align with our values and our ethics and our, our collaborative practices so yeah, thanks. I
had
like that
recently.
I got a little cheer off into the side since we're recording. Just, everyone's like, yay. New
I have an
healthcare
example.
systems. Yeah.
I have a recent example of that. We had a student come in the office this week, and they graduated a year ago with the honors, through the honors program, and they work at the UNM hospital. And I'll tell they're a nurse. So they came in and they were like, I want to be involved in the IPE program still. And because I want to address your very question, because I went in and I sort of had, and I'm paraphrasing, but she says I sort of had stars in my eyes, and I was a recent grad, and I was gonna, and then I got there and I thought, oh, this is different, a little bit. And so she says, yeah, I want to help prepare the students to make the change. And so that was actually really energizing for me, and sort of like it just validated what Heidi just said, and it validated the program that we have and the problem. And so anyway, hopefully that adds a little bit to it, but I just had that experience this week. So
that's a great story. Can you, so you're telling students, and I think this, maybe when you go into practice then, and you're going to make the change, and they're, you're teaching them then how to advocate for this and how to drive it forward. Have you had to do any of that work within, say, your own school with people that maybe are not completely on board? I think sometimes as educators, we sometimes run up into colleagues that are maybe not always going to be like, yes, this is the way that we need to do it. They're more old school folks thinking, why are we changing this? Why can't we just, it's worked. It's always worked. We don't need to make these changes.
Yeah, absolutely. I mean, I think, inherent in being in academia is that we come in, at the top of our game, and we walk into a new situation after having been in practice, really thinking that we understand, everything that we've gotten really good at who we are as, as a doctor, as a nurse, as, and that shift into thinking about what's emerging, what are we growing, what does the next generation need to understand? I think that's something that's hard for all of us. We rely on our experiences, and we think, right, I've had all these experiences. This is what interprofessional collaboration looks like. Todd and I laugh about interprofessional collaboration looks like just tell me what everybody does so I can tell them what to do. And it's, and like, right. So then it's, it's about nudging. It's about bringing people into the fold. It's about being curious. We had some students actually at one point work on a model for what's the model for sort of the vibe, for the lack of a better word, frankly.
Yeah.
What's the vibe that really supports interdisciplinary collaboration inside of a clinical setting, right? And the vibe is about vulnerability, right? And so even as faculty, recognizing that there are things that we don't know, there's stuff that's shifting every day. And we need to model our I don't knows. That's really hard. I mean, that's hard in academia, and it's definitely hard in, medicine and nursing and healthcare professionals. And when you really talk to people about it, they're like, oh yeah, there's a lot of stuff I don't know. I just don't want to wear that on my sleeve because I don't want people to not trust me. But when you start to look at the literature, there's more trust when we say, I'm not sure. Let's think about this together. What do you think? What does this person think? How can we crowdsource this particular problem set? And when you start to approach things in that way versus the way of like, oh, well, I've got all this experience, so you should do this. I think the faculty soften. And then they are like, oh, this is so relaxing, right? Like this sense of like, I don't have to carry the weight of the world and all of the decisions on my own shoulders by myself. We have each other's backs. We can carry the weight of these decisions. And, very specifically in partnership with our patients. So when the students designed this, like, what's the vibe? I'll just put this here. We were thinking about who's on the team, right? And in patient-centered medical care, if you think about like, what's the image of patient-centered medical care? We've got the patient in the middle, and then we've got like the people with the white coats and the little, the little pads that they're writing on, kind of consulting with each other, and they're all wearing stethoscopes. And so for us, for what we co-created, we put the patient on the team. So and then put the problem set in the middle. So that's actually problem-based learning model, which is what educators use with kids. And so the patient's perspective of the problem is the center, right? Or everyone's perspective, but like, what's the health issue or what's the wellness issue that we're working with? And then as we put the patient on the team and we think about everyone on the team actually comes in with a unique perspective and understanding that needs to really be paid attention to, a unique set of experiences and stories that can inform how we are going to work together to help someone, that kind of thing. And so, when we start to move into this partnership model, to get back to your original question, like, how do you work with faculty who are resistant to IPE? Is we talk about what are the things that stress us out as healthcare professionals. What stresses us out is that we're always in the decision-making place. And that's hard. It's hard to know because, it's not a cookbook. Every patient problem is completely different than every other patient problem. Even though we may have seen an ear infection 15 times, or whatever. I mean, ear infections aren't a great example, but everything is different. And when we have a lot of people around us as we're looking at these, complex health problems, we have, and when we have like, friends and consultants, and we're all working together to sort of move with ideas of shared decision making, it takes that pressure off. And I think what Todd and I have found, and I know for our faculty and the folks that we work with closely and our students, it reduces our stress. It reduces our burnout, right? When we know that people have our backs and we have their backs, it energizes what we're doing in healthcare, and it's it feels good. And so I think that's where it's that's kind of where we've been able to really make some movement, is that, we always say, when faculty come to play with us in any interprofessional education, they have fun, and then they come back, and they have fun, they get energized, they love those collaborations and learning from each other, they love the interaction, and then they come back, usually on their own time, like, and it's the same thing for the students. They come and do one interprofessional education thing, they meet each other, and they're like, oh my gosh, I had no idea that this whole group of people knows how to do this thing. So I can always work with them around these things that are, that are complicated. And then they want to come back, and, so it kind of nourishes itself, I guess.
I have one more item on that. I think to answer your question, I think research. So I think research is part of the answer. And in our systems, it's money and time driven. And so interprofessional clinics are more effective, and there's better patient outcomes. So I think that the sort of bottom line minded leaders, I think the research is where we can show them that what we're doing actually, improves the bottom line. It improves patient outcomes first, but I think they do think about the bottom line a lot. And so if we can show them that everybody wins, and we do that with research, and there's some research out there, but not nearly enough. And so this is my sort of, for whoever listens to this is a call to action. We need more research in this area to prove what we already know.
Love that. Thank you. I'm getting fired up just listening. So you're inspiring me for sure. And you mentioned leadership. So I'm going to sort of follow that thread momentarily. Imagine that we've got a listener today who is a leader in some capacity, with responsibility for interprofessional education. What qualities do you think, or characteristics, are really important? You spoke eloquently earlier about one of the people that helped you. So if you could just expand on that a little bit, what kind of qualities, characteristics would you encourage IPE leaders to sort of develop to really maximize IPE wherever they're working?
Yeah, I mean, I think one of the things that, we, kind of like most programs, we're working from the, IPEC competencies, right? The IPEC. And I think they're good, and I like the new ones quite a bit. And I also think that we need to understand as healthcare professionals and as educators, like, how do we do systems change, which is not change theory, like how do we make people change, but how do we actually think about co-creating emerging systems for what we need to align our health and well-being with the health and well-being of our communities with our values, right? And that that sort of movement building, and I want to just name, I pull this very directly from the work that the Planetary Health Alliance is doing, that I will talk about in a little bit. But the systems change, movement building, co-creating emerging ways of helping patients and communities improve their health and well-being overall, looking through all of the determinants of health, that is where we really, I think, need to focus, because we have very complex, wicked problems in healthcare and health in general, for multiple reasons, for all of the social determinants of health and the ecological determinants of health. And the only way that we're going to tackle these problem sets is by thinking in totally new ways and being innovative. Todd is an amazing example as a partner. Didn't have the opportunity to be a healthcare professional, but brought in his own sensibility as a person who's experienced the healthcare system, as a person who's experienced the healthcare system problems in caring for his family members, and then brings his MBA and his learning science and his like unique Tetris abilities to actually think about how do we create an IPE program that models creativity, that models student-directed learning, that models innovation, and these are the people that we need to find, and what we need to work with.
Yeah, I think energy is an important asset that a leader possesses, and curiosity. What can we do? How can we do this? Basically, I think they do need to have a knowledge of the system, and they need to understand what IPE is. So, like, I think they need to be a little bit of a student of IPE, and preferably to have some clinical experience would be helpful. I know I'm doing my thing, but I think, I work with Heidi and all the other faculty, and I think a clinician mindset with that curiosity and understanding of what IPE is those probably are the best assets of a future IPE leader.
So kind of going on from that, I think, it sounds like you guys have such a great collaborative team that you've built in New Mexico, and it sounds brilliant. But I think for a lot of us, at points, when you're working on this, being in interprofessional education can be quite isolating because you're like a bit of it, or or maybe isolating just within the whole broader community, and you're just like one little bit of it. I know, Anne, we've talked about your institution, it's like being small, and you are the IPE center that you've got. We here in Nottingham, we've got a group, but staff, technically, there are two of us. So how do you reach out? What do you recommend that people do to find like-minded people and connect with the wider IPE community?
Yeah. I think one of the, when I started in the IPE program, the reputation of the IPE program was they do IPE, right? The idea that we don't have to do IPE, the rest of us, because those guys do it over there in the IPE office. And so I think shifting that narrative is probably the most important thing that anybody can do at a university, is like, no. You do IPE. I'm just helping you organize it, right? I'm in service to your IPE mission. We had to shift that narrative early on because we weren't getting anything done. People are like, I don't need to do it. You guys do it. And it's like, we can't do it. You have to do it. We'll organize it, right? And so I think that's one thing. The other thing is, we all have, I like to think we all have our purpose, our mission, our passion, right? For me, it's, I worked in, treating addiction throughout the state for a very long time. I've shifted now from addiction to something that's easier, climate change. So I'm working in climate change and the health impacts of climate change, just to kind of take a break from how complicated treating addiction is. But I think we all have something that we care about, whatever that is, right? And so when we, as faculty, as health professionals, as students, when we start to engage in that thing that we care about, the reason that we are here, the reason that we are, doing the work that we are doing, whatever that is, we know, I think inherently, whatever that problem set is, that thing that we deeply care about, we know that we are better able to address whatever that is, right? Whatever health disparity, whatever, program we want to see implemented, we know that we can address that with more people and, a wider variety of people. And so it's on us to find those communities. For me, we started, what Todd and I started doing is we just started branching out. Interprofessional education ended up not just being, the trifecta of nursing, medicine, and pharmacy, right? We started playing with, we started playing with PT and OT because we have those two programs, social work from another school because we don't have it here yet. And then we started thinking like nutrition, psychology. We brought in athletic training, which is a program on our main campus, and now our current director is actually from the athletic training program, right? So we started speech and language pathology. We started branching out. At one point, we were collaborating with the engineering program on how just mostly like bringing health students together with engineering students to think about what are the design issues. And so, that was actually an initiative from the engineering program to us to do design theory and design-based learning programming. And so, and then with the planetary health and the stuff that we're doing with the Accelerating Resilience Innovations in Drylands Institute, our ARID Institute, then we started playing with community and regional planning, landscape and architecture, more engineering, environmental sciences, geosciences, the business school, the policy programs. And so it's interesting, like once you start meeting people across campus and thinking about how does everybody's work intersect in human well-being and flourishing, right? Which is kind of what we want to see in healthcare. Educators, are thinking about well-being and flourishing, everyone. And so we found our community in just meeting people at the university and asking that, like we did a whole project with journalism and communications. So we worked with students, the journalism students wanted to do a student health and well-being program for our undergraduate student body. And so our healthcare profession students partnered with our journalism students to figure out how can we bring students together in community to be heard, to support mental health during that pandemic that we had. I don't know if you guys had it in where you were, but we had a pandemic in New Mexico.
So that was rough for IPE.
Yeah. Oh yeah.
Was.
Yeah, absolutely. It was rough, but it was also, sorry, I keep talking, but having a pandemic was horrible. And, it'd be nice if we didn't have to repeat that experience. And it was actually an opportunity to really innovate for all of us, right? So everything shifted. How we do education shifted, what our expectations are shifted, what people's experience of health and well-being also shifted. Everybody experienced a major health crisis at the exact same time. And that actually allowed for us to start to think about how is it that each of our professions are actually deeply connected around, human health and well-being. So, I think it, one silver lining, which is, very faint, was that the pandemic was actually an experience that we all had together, and it gave us a shared ground to look at what do we need to do better going forward? What does this need to look like if this happens again? That kind of thing.
Yeah, so I think we looked internally to answer your question, or go to kind of circle back a little bit to the question of how to not be so isolated. I think we first looked internally, and we first looked at the programs that that were sort of adjacent, but hey, can we do that through an IPE lens, right? Do they have a part to play? And Heidi was right about, the community health and the togetherness. So that we looked internally first. And now what we're trying to do is, we have the internet now, and so we try to network. So this is a good example of that, right? And so what you guys are doing is actually part of the solution to that. And you guys we're building a bigger community through things like this podcast. Other events, other online things. So I think leveraging technology is a big part of that. If you're kind of alone, there's other people that are alone, but you don't have to be physically together. So I do think that these kinds of activities are sort of a good resource to not feel alone, and to gain that energy to keep going and to understand others are going through similar things, and we can kind of forge on together. So
before we sign off, we want to remind you that whether you're a student, a practitioner, or educator, the work you do is important and can be stressful, but you're not alone. Please take care of yourself, let's look out for each other, and we hope you'll join us again soon. That brings us to the end of part 1 of our conversation, Beyond the Silos, Navigating IPE Education and Practice at the University of New Mexico. In part 2, Beyond the Borders, we'll dive into how the UNM IPE Honors Program is being reinvented and expanded, with exciting opportunities for collaboration across regions and cultures. Don't forget to follow or subscribe so you won't miss part 2. And thanks for listening to Interprofessional Space. We'll see you in the next episode.